I first got involved with the NIHR mainly as a researcher in the early days, applying for grants, and then became involved in some of their committees, going on to chair one of the clinical trials panels. And that really sparked my interest in trying to make a difference at a bigger level across the NIHR on a national and international stage. One of the transformative fellowships that I received was an NIHR research professorship, because it takes you from being in the foothills of your research career and just accelerates your trajectory. It was such an exciting time for me because it really enabled me to widen my reach and the research collaborations, and made a change to so much of my pregnancy research. As Chief Executive of the NIHR, I lead the organisation to improve the health and wealth of the nation, driving improvements for our patients, for the workforce across the health and care system, and for the system itself. When I came into my role in 2021, it was the middle of the COVID pandemic. The NIHR was helping to deliver trials at pace and scale, and that really changed the course of the pandemic. But what we needed to do next was to reset our research portfolio for all the other diseases which had taken a bit of a backseat. One of the first steps that we did was to make sure that we were focusing on the research that could deliver the greatest impact. Critical areas like cancer, dementia, mental health, addressing some of the issues that had emerged during the pandemic, for example, around the waiting lists or around the mental health of children and young people. My area of research is pregnancy hypertension, which disproportionately affects Black women. So our research needs to reflect that. We've made research inclusion a condition of funding at NIHR, so that our research can best reach the entire UK population, whether it's through demography, geography, or any other factor. We're asking researchers to work with those who are typically underrepresented or less well heard, and to ask how we prioritise and design the research with those groups so that we are most likely to reach them. We can see in several areas why that's important, such as the development of vaccines or of other treatments, so that when we get to implementation, we reach all of the people who can benefit. Health and care happens in so many settings, and so research should mirror that. We know that a person or a patient will access care through many different routes, whether it's through their GP, through a hospital, through a community setting, or even in their own home. We want research to reflect that patient's journey. We are also funding research in many more settings, so primary care, community, and through engaging with patients in their own homes, so that we dismantle the barriers that we've had in the past. We fund research that will directly impact health outcomes, but we also support our UK workforce, and we're a magnet for global talent. And together, these really can impact our health and care system to make it fit for the future. It's essential that we see continued investment in UK research and development, particularly in health and care research. For every £1 invested through the NIHR, we see £13 of benefits. We're investing in a number of critical technologies, such as artificial intelligence, but also in engineering biology, which drives new medicines, and in areas such as genomics, which will drive precision medicine of the future. One example of the great work that our biomedical research centres have delivered is the gene therapies that we are really seeing as such a promising technology for many of the diseases, including sickle cell disease, beta thalassemia, and other similar conditions. I see it firsthand what a difference it can make in my antenatal clinic, where the research that we do delivers real change for the pregnant women in front of me, and seeing how that can be translated through every health and care condition. In the next 20 years of the NIHR, we will continue to see it being ever more relevant and visible across all of healthcare research, and provide the engine for the system of improving care every day.